Steppin with Marcus J. Thank y'all, everybody, for staying with us, being down with us. 8044-022-893 is the number to dial to be down with the flagship show of Legacy Internet Radio. At this time of the show, as we do every single week, we profile a missing and/or exploited child. Tonight is no different. Tonight, as we have in the past, we are continuing to look for Victoria Williams. She's an endangered runaway from Newark, New Jersey. Her date of birth is November 15, 1999. She's been missing since October 19, 2013. She's 14, black female, medium complected, 5'6", weighs 133 pounds, with black, long hair. If you have seen her, please contact the National Center for Missing and/or Exploited Children on their website, missingkids.com, or please contact the Black and Missing Inc.com or Black and Missing Foundation. Call them up by phone at 1-800-THE-LOST, 1-800-843-5678. Let's bring Victoria home. We've been looking for her since October. We've profiled her at least 3 times in the past. We need to continue keeping our eyes open for her. Ain't no half step on Marcus J. 804-402-2893 is the number to be down with the flagship show here tonight. At this time, it's time for me to pass the mic over to my co-host, because she finna make us healthy. And I said finna on purpose because she gave me a hard time last week for saying fitna. Which
don't y'all believe it? I ain't fitna nothing.
You ain't, not
in the dictionary I own.
I mean, why you acting like? Oh, see, I can't say finna, but you can do all that, right? You can pop the tongue, but I can't say finna. Really?
You said it
twice.
So what's your question again?
I don't even remember. I don't remember.
Yeah.
Ain't no hashtag Marcus J's very own. That's why Butler make us healthy.
Hello, darling.
How you doing, darling?
I am. I walked in the room, and I was happy to see Jay.
What up? You happy to see him?
Yeah, I like when they stop by.
What else? Him?
And old LP is sitting in the back like an old 33. But DJ Renee Melendez is in the house. I was like, oh, shoot. We're being invaded by NJ.
Of course.
So it's so good to see you.
And she's actually from New Jersey and not Pennsylvania.
Oh, I'm sorry. Your bike still works?
Yeah, it does, because I'm in control of it.
Yeah.
You over there. I'm right here.
I'm going to fix that. You just wait. Yeah, baby pictures again. He's showing me, y'all. But, there were so many things on the news about health over the last week. This is out. Somebody's got this. Somebody's got that. I was confused as heck. I didn't want to look up stuff because, good God, I might have one of them. So what I decided to do was shut my eyes and pick something. Haven't done a health segment in a little bit, so I have one for you today. And it's called SARCOIDOSIS. SARCOIDOSIS. And what it is a growth of tiny collections of inflammatory cells. And the cells infect different parts of your body. Most commonly your lungs, your eyes, your skin, and your lymph nodes. So while the doctors say there's no cure for sarcoidosis, most people can live moderately with treatment and not too much pain, not too much trouble. And then there are some who will experience pain and hospital visits for years. Now, I'm going to need you not to do that.
Okay.
And if you don't know, you better ask LP.
I'm waiting for the cure. How you catch it?
Now, I'm going to go through some symptoms. Some of the symptoms, they do vary depending upon which organ they're affecting. Now, you may develop some of the symptoms gradually, and you may, it may take years for you to realize that this is it, or you just might get hit suddenly with a whole bunch of symptoms and you just don't know why. Because some of the symptoms can be confused with other things, it has to be looked at on an x-ray for diagnosis, especially if it's in your chest. So you may experience being tired, having a fever. Your lymph nodes may be swollen. You may have sudden weight loss or just lung issues, any concerns with your lungs suddenly. You may have a persistent cough, shortness of breath, wheezing, chest pains, and maybe some skin symptoms like maybe light spots, dark spots, patches, itching. It says 25% of the people who have sarcoidosis develop skin problems that include a rash. And to be on the lookout for the rash is red or reddish purple with tiny little bumps. I'm sorry. She acting like she discovered a rash. In tiny little bumps. In some areas of, the body, it may be even warm or tender to touch. Okay? Now, you may also discover lesions on your skin. And there are disfiguring skin sores that may appear on your nose, your cheek, your ears. They may have color changes, may becoming lighter or darker than your skin color is itself. You may also notice up under your skin around scars or tattoos. If you see the little swollen the swollen areas with the little purple or the reddish, looks like little bumps or little pimples up underneath them. Now it can also affect your eyes, and sometimes it may affect your eyes without any symptoms whatsoever. So it's important, it says, that you have your eyes checked, and we know we should be getting our eyes checked every year to 2 years anyway.
Because you wear glasses.
You may experience blurred vision, eye pain, redness of the eye, severe redness of the eye, a sudden sensitivity to light. All right? So if this happens, it says, get to your doctor.
Sensitivity to light? You mean like a gremlin or something?
No, I mean like sensitivity to light, period. I'm gonna need you to, y'all.
I wasn't sure.
Mess with you. I'm not always
Okay,
here.
see, Renee's being bad. I think she's been influenced,
Hell yeah.
negatively influenced.
You said sensitivity to light. I just wanted to know.
No,
I mean,
like
because
what's the movie Nicole Kidman played in, The Others, when they couldn't go outside?
yeah,
So it could be that.
like that. Yeah,
Yeah,
like a gremlin.
gremlin. Okay, so if you experience any of those symptoms, we're not saying that you do have it, but we're saying go see the doctor.
Oh man, did you really go there?
That's the name of the segment. Go to the doctor.
Yeah.
And we're not
but-
talking rap music.
Yeah, but when you say that, you start thinking about nasty stuff, man.
Man, that was hard. That was just hard to get through.
Yeah, man. You remember that song? He ain't talk about no sarcoidosis, that's for sure. Shoot.
Nah,
Do you have any other maladies?
He was dripping.
Yeah.
Aww.
You
Y'all,
You
you
brought
brought up issues. She has
Is it
been,
sarcoidosis, right?
You brought up the
Yes.
song.
I think
she's been influenced.
Bernie Mac died from sarcoidosis.
Yes, he did.
Yeah, he
Really?
did.
Of the lungs.
Yes.
Of the lungs,
Yeah,
yeah.
he
Oh,
did.
Sure did.
wow.
Mm-hmm.
Okay. So the doctors, again, the doctors don't know what causes it exactly. They say it can be genetic. They say it can be triggered to bacteria or viruses, dust, or chemicals. Could be something in the air. When you go see the doctor, they ask you about whether or not you work at a plant of some sort where you can, inhale fumes or anything like that. Normally, they say the immune system, well, we all know that it's supposed to fight and help us, but in this case, it can't help you. There's no defense.
So you dead.
Well,
If you
you're
get
not dead, but you can't say you can't get it. It won't fight it. Okay, so I'm going to go through some other risk factors. Age and your sex. It says often occurs between the ages of 20 and 40, and women are more likely to develop the disease than men. As far as race, it says African Americans have a higher incidence of sarcoidosis than our white counterparts. Also, sarcoidosis may be more severe and more likely to recur and cause lung problems in African American communities. Your family history, if you know your mom or your grandmom had it or grandpa had it, is also another factor. Any questions?
No, you
Nah,
rolling.
that joint's
You rolling it wrong.
Cool
You rolling
beans.
along.
Complications.
Making me want to go get checked out for sarcoidosis. Because I be having issues and stuff, and I can't see. So go ahead. I'm sorry. I'm with you.
You know
You've
what?
been able to see for a long time.
I had my first pair of glasses at 5.
Oh yeah, so it's not sarcoidosis, son. You just can't see.
1979.
Well, I couldn't see since I was a kid either.
For real?
Yeah, I think I had glasses since about 6 or 7.
Me too.
Mm-hmm.
It sucks not being.
I
able
just
to see.
can't see it. Good Lord, it's getting worse.
How many
And
fingers
when
I
you
got
get
up?
40, there's nothing you can do about it.
You mean to tell me that it's all downhill for all us in
It
here?
is so
Actually,
downhill.
no. I went to the eye doctor, and he told me that my eyes stayed. I had the same prescription for the past 5 years,
I don't like you.
and they
Yeah.
said that it stopped. It didn't get progressively worse, but it I actually got better.
Yeah, we're all jealous
What?
of you right
What you smoking?
Huh?
That ooh.
now. Grab a
Weed.
mic, man.
I don't do none of that stuff.
When I went to the eye doctor, we're going to jump off the subject for a second. The last 2 years, my vision has been going down. And he says that usually between prescriptions, it may change like 1 point. The first year, I went 1 point in the right eye, 2 points in the left eye. This year when I went, I'm 3 points in both eyes.
That's not good.
I just keep praying, dear Lord, please don't let me go back.
Better eat some more carrots.
You're gonna be
That's not
like
true.
you're gonna be like Mary on a Little House on the Prairie. It's gonna be like gradual. Then
That's
you're gonna wake
not
up. It's gonna be
honey.
so
So
wrong.
You're gonna be like.
Oh
remember
my
that blind
God.
joke.
You gotta start screaming, and they have to come in and hug you and stuff, and then they're gonna put you in a wagon and
Oh
take
my
you to
God.
Sleepy Eye and try to get you glasses.
But I'm going to be blind if I'm going to be like Mary.
Yeah, they're gonna put you in a
But Mary
wagon
had
and take
that
you to
fine husband, though.
Linwood
Y'all
Bennett.
are on here talking about
Yeah,
Little
well,
House.
I
on
don't
the
Just
care.
saying,
I
they
didn't see
go-
him, but he looked
Hey, look,
good.
they
I'll pass on the fine husband.
She
I
ain't
just
know.
want to see.
She ain't know.
She was feeling his
Look like
face.
she
I'm
wasn't
telling
blind
you.
to
She
begin
pulled the
it.
Lionel Richie. She was feeling his face.
Hello. I'm telling you, Paul's gonna put you in a wagon and take you to Sleepy Eye.
Oh, you know what? That's enough. Okay, complications. Now it says, like for most people with sarcoidosis, the condition may resolve itself on its own with no, severe consequences. But oftentimes, if it's chronic, complications may lead to different parts of your body.
She
and
said chronic.
things. You
Sorry.
know what? I'm gonna have to stop you. Shut your mic off.
Okay.
The lungs, if untreated, pulmonary sarcoidosis can lead to an irreversible damage to the tissues between your air sacs and your lungs,
What?
which
sack?
means air,
Oh,
which means you won't be able to breathe. You gotta remember today is Monday. All right.
I will get checked if that other sack not working.
I declare, Jesus, please help me. What's wrong? Your eyes. Inflammation can also affect most parts of your eyes and eventually cause blindness. Now, rarely does it cause, it says, glaucoma and any cataracts.
But there's something for glaucoma. It's
We're
the
not
chronic.
going to go there. Why? What? You know what?
I love her.
You got to
man.
shut off her mic
No,
now.
no.
She's
that's
part
my
of the crew.
You want everybody, Mike?
Because y'all are
She
misbehaving.
got that Nancy Grace syndrome. Shut off her mic.
Okay, your kidneys. All right. Sarcoidosis affects the part of your body that handles the calcium. And so if you get sarcoidosis there, or it will shut down your kidneys. Your heart. I mean, really? Do I need to say more?
Yes.
you can have a heart attack.
Oh, okay.
You can die.
Dying is not good. That's
No, it's not.
Nah.
Your nervous system. Okay. It says a small number of people, so it's rare that it damages your nervous system. But you can develop problems in your central nervous system, which will damage your spinal cord, hence the brain.
That's crazy.
Okay.
Sarcoidosis ain't no joke, man.
No, it's not.
Ha ha ha.
And I was going to do a puzzle and see how many words you can get out of the word sarcoidosis, but I
Really?
think that was fun.
Seriously though?
Yeah. I think it was fun.
Love A-class stuff.
Oh, y'all not shaking your heads at me. When y'all sitting up here talking about
I was
the
thinking
what
about your
sack,
movie
the
trivia from a
chronic.
couple of weeks ago.
Shoot.
So,
She said she promised us some man trivia.
yes,
so
I'm going to do some man music trivia.
that's what I'm talking about.
Man, music trivia.
Yes,
right.
I'm going to make my host here happy, and I'm going to do some rap music.
That's what I'm
And
talking
I'm going
about.
to combine the music.
Word.
Remember how I did it before?
Yes.
I'm going to combine the music, maybe 4 songs instead of like 5 or 6. I'll do tops 4. Play them, and you got to guess
What song it is?
what the song is.
I'm gonna win, y'all, for real. I'm gonna win.
I had to call in that night.
I'm
Well, I'm going to keep you posted on when it's going to happen. It's going to be soon.
gonna win. What you say, Grizz?
I wanted to show you something, but we on there.
Oh, no.
my
If you show me
stars.
something, boy, I might cuss on the air.
So, you think you may want to get checked for sarcoidosis. Here's what you need to do and prepare yourself for your doctor's visit. You want to write down the symptoms that are causing you concern. You want to list any medications that you're taking, including vitamins or supplements. You want to write down any medical diagnosis that you've received at any time. Don't even look at me. And you want to write down certain questions that you may have for the doctor, like, in my condition, what may have caused it, or what tests do I need, and what treatments can I get, things like that. What can I expect in my appointment from you, or once that you're diagnosed, how often you have to be seen. You want to write down how long you've been experiencing the symptoms. You want to know when, they want an estimate of when it started. Are you still feeling that symptom? Tests and diagnosis. Now, again, it can be difficult to diagnose because some of the symptoms can be something else in the early stages. But again, you want to make sure that none of your organs are being damaged, so you're going to have all kinds of x-rays and scans done. Your doctor's going to do a physical examination. He's going to want your family history, pretty much just like when you go to the doctor now and you fill out that little paper. Does anybody have this, that, and the other? Yes, no, all that business. So you're going to have x-rays, CAT scans, MRIs. You're going to have blood tests. They're going to give you lung function tests to measure how well you can gain oxygen breathing in, how well you can push out air, and you're going to have an eye exam and possibly a biopsy. So with that being said, the last thing I'm going to do is treatments. If an organ is in jeopardy, then they'll treat you accordingly to that organ, whether it's liquids, pills, or let you know how long you're going to have to take it. You may have to take steroids. You may have to come and get injections. You may have to just take regular
I gotta take
pills.
steroids.
What did you say, Dee?
I gotta take steroids. That's like performance enhancing
I
drugs.
can't put no mercurochrome on.
So that means if I get sarcoidosis and they give me steroids, I'll come in here and be like the best talk
bet
show
you
host
mercurochrome on
ever
that
because I'm
list.
on performance enhancing drugs.
That cures everything.
Is that what you're saying? How about some methylate?
Yeah.
And so lastly, you may
Bison
also
Tracy
need
ointment. I'm
Right.
sorry.
surgery, because if it damages your lung to that extent, you may be looking for a transplant.
Yeah, man.
I
That's,
can't drink no tussin for it.
No, sometimes some things just don't help everything.
I'm spraying Windex on it.
Okay?
get that tussin.
So that is my lookout, my healthy segment
For
for you
sarcoidosis.
guys.
You know, it's funny because when we have That's why I do our healthy segments. We like to try to sometimes make jokes, but the reality is, you always come up with stuff that we may not know of. They may not be on the tip of our tongues, but these are things that we all probably know someone that suffers with them.
Yes, and I do.
And we may not know directly. We may know this person is, kind of struggling, but we don't know their plight. There's a saying that, you walk a mile in someone else's shoes. So the next time you see someone that struggles with some of the symptoms that SY laid out for us tonight, try to have a little bit of sensitivity for them, because they may be dealing with something like this. So like I said, we like to joke and have some fun with it, but the reality is, be mindful of what other folks' struggle is. Ain't no half step on Marcus. All right, we're going to take another break, and when we come back, we're going to ask what the hell, y'all. We want to know what's going on with the rabbis and the circumcisions. We want to know what's going on.
It hurts.
Hey, yo, this lady, right? She was abandoned at birth, and then she met a very interesting person later on in life. We'll talk about it. Ain't no half step on Marcus J. I got a full crew tonight. I got Jay Grizzy. I got SY. I got Mr. LP. I got the first lady of Legacy and Net Radio's in the building. She ain't grabbed the mic, but she's going to give me one of those ow-ows. Can I get an ow-ow? There you go. Of course, and we got DJ Renee Melendez helping me represent Jersey City, New Jersey. Ain't no half step with Marcus J. Be back in a few minutes.